So we have 5 panelists here. Thank you. I hope everyone got a little bit of movement. Thank you for the opportunity to moderate this panel. I would like to introduce all of the panelists right now from the countries and the international perspective. So from left to right, we have Indra Lilina from the State Emergency Service in Latvia. She is the Deputy Head of Department for Disaster Medicine and Preparedness Planning and Coordination. Indra works in the field of emergency and preparedness since 2005, I believe with the first SARS outbreak. And one of her functions, she's covering the IHR National Focal Point, and she has been involved with Work Package 5 work group on IHR strengthening. Next, we have Paula Vasconcelos. Paula is the High Senior Expert of Public Health, supporting coordination for public health emergencies, and the Operations Center at the Directorate of Health in Lisbon, Portugal. Since 2000, she's been working in public health emergency preparedness and response at the subnational, national, and international level. She has experience as a former ECDC and WHO staff. To the left of Paula, we have pleased to introduce Timo Butler from the Federal Office of Public Health in Bern, Switzerland. Timo is a biochemist and a toxicologist, and he joined the Institute in 2014, and since 2016 is responsible for IHR NFP in Switzerland and is the organizer of the Joint External Evaluation for Switzerland and Liechtenstein in 2017. During COVID, he's been responsible for international contact tracing and for developing the Swiss PLF. From the international perspective on the screen, if everyone can look up, is Virginia Arnetti from DJ Sante, and she will be with us in line from Luxembourg, where she works as for the Public Health Directorate of Health and Security Unit on the implementation of preparedness elements and the regulation on cross-border health threats. Then we have Svetla Toslova from ECDC, whom is here in person with us today. She is the principal expert for preparedness at ECDC and working at the agency since 2007. Svetla has been our liaison officer for Work Package 5 in this joint action. And finally, we have Jussi Sane from the WHO, Euro. Jussi works with emergency preparedness and IHR monitoring and evaluation related topics in the European region. And he specifically led the work on COVID-19 intra-action reviews and after-action reviews, and he's been involved in Work Package 5, previously from THL and now as our WHO liaison. So with that, I'm very pleased to allow all the panelists to proceed with their interventions, starting with Indra. So welcome, Indra.
Yeah, thank you. And it's very great pleasure to see all my friends and colleagues here. And today I would like to share our experience, the country experience of building up the IHR core capacity, one of the core capacities, and that's related to the surveillance. But more specifically, it's related to the hospital data management and overview of the hospital data in a real time. And as a short introduction, I should say that actually in Latvia, each hospital has their own system, like the patient data system, and it's not centralized in a real-time manner for the response, and even though as well for the response in emergencies. For the preparedness reasons, my department, we collected the information from all hospitals twice a year. That was before the COVID hit us. And that was mainly through the emails, through the Excel sheets, and then we put together manually all that information. But when the pandemic hit us, we realized that, of course, we needed quickly information from the hospitals of the bed occupancy. And after like when time passed, we realized that there is a lot more information we need from the hospitals to take the decisions. We needed that centrally to analyze and take the decisions. So, and with the private investment from the private company, at the very early beginning of the COVID, we created the national web-based system for the hospitals to report nationally bed occupancy. And with the time, of course, the system growed, and we added more information on all kind of the resources the hospitals has, and one great part of the system was the information about the PPE consumption in hospitals, because it very greatly helped us to plan the joint procurements and plan deliveries for the hospitals. So what I should say, that the system still is not real time system, because it asks and requests the manual work from the hospital part. Someone in a hospital should count and add that information in the central system. It's not linked with the hospital own systems. It's ongoing now as a pilot project in several hospitals. We'll see on the results, fingers crossed. It's not done yet. And what I can say, that actually at least this achievement that we created this nationally created this web-based system is one of the IHR capacity strengthening process, because I remember in 2017 when we had the GE, one of the recommendations as well for us was to create real-time system for the hospital resource or data management. And it took some years, we did it, but it's not like really very sufficient, probably. To some of you it might sound like that, but we are still working on this to improve. Another challenge, one is to link those hospital systems to the national system, which requests, of course, the money and investments. But another great challenge, actually, after the COVID, during the COVID, there was no problem with those data entry and accessibility. Each hospital did it twice a day, and we, like twice a day, got the information and actual information. But the next challenge is the interest of the hospitals to continue that, and especially manually to continue to put that data available to the national levels. So yeah, thank you, and I'm open for the questions later, I think. Yeah.
Thank you very much. Off to Paula.
So good morning to everybody. Thank you for being here. We have 5 minutes, each one of us, so we decided to pick 5 points to try to bring them, because this is the work package 5 on international health regulation. So we have to talk higher? All right. Okay, on coordination, I think this workshop was very important, because suddenly there were no more target countries. We were all living the same experience, and all of us were target countries. So whatever we learned from this, it's going to apply in the same level, where we can contribute, not because we are logistic or hosting countries, because we are technical contribution for the EU global health security. The other points on technical, the core capacities where Portugal was the best, we think it's the ones we could apply easily, the lesson learned from COVID. In surveillance, we were very high average, and indeed, because our system were already digitalized for morbidity and mortality, and it was very easy to integrate from digital extractions from health services to integrate the information from the public health services on contact tracing, on measures, on vaccination, together with the classical epidemiological data. But it represents a lot of challenges in regards of the tools, although we had the procedures in a concept. The other ones that we were very low, we keep low because human resources are still a problem. We thought the pandemic would teach us to improve public health experts, and it took the other way around. Suddenly, all the others are experts in public health, and we are minus and minus. And so a challenge to consider. The other aspect on communication and dissemination, everything we are producing should be communicated, should be disseminated, should be used for further. As well to create sustainability. We believe that everything that has been produced with this amazing joint action, it's a joint action that started before the pandemic, survived the pandemic, and has lessons learned to bring. It starts with the previous cross-border threats that was moved to new regulation, not only on cross-border threats, but with a large impact on countermeasures, on new mandate of the CDC, and all those things need to be applied in our countries in a sustainable way. And also the last point, of course, with evaluation. So overall, what we think that the challenges are still for the future, to make sure whatever procedures we need to change, they reflected in the tools that needs to be applied to interact hospital data, lab data, public health response data, together with the proxies and indicators that will not overwhelm the risk assessment and provide good guidance for decision making. And of course, again and again and again, human resources, how to make sure our decision makers are going to understand that public health indeed have specific expertise with high experts requirements, and we need to make sure they are in numbers and able to use their expertise so to better improve capabilities. And of course, I'm open for further discussion. Thank you very much.
Thank you, Paula.
Well, thank you very much. Good afternoon, ladies and gentlemen. Dear colleagues, I'm very happy to be here, to have been invited, not as a participant really in the SHARP action, but what I'd like to do is to tell you a little bit how Switzerland has survived the pandemic, and focus a little bit on the points that were perhaps raised during the JE that Switzerland has gone through in towards the end of 2017, roughly 2 years before the pandemic. So first of all, I'd like to perhaps mention a few of the positive points that, in our view, Switzerland has followed a rather liberal strategy, which ended up that evaluations attested that Switzerland has relatively well passed through the COVID pandemic and also recovered relatively fast. It was led by a task force that was relatively quickly established, and that was also then extended upon time in a timely manner, and it united all the necessary competencies to evaluate and take the decisions or propose the decisions for the federal government. It was paralleled by a scientific task force that was really there to deliver the facts and advise both the task force but also the government on how to decide. What was a positive aspect in my view is that the healthcare system during COVID did not break down. Like in many other countries, it was well under stress and sometimes running at the limit, but fortunately the health care was still able to be provided. The overarching goal of the task force and the measures taken were really to relieve the pressure from the healthcare system, as has been pointed also by Mika Salminen before. Protect the population and relieve the pressure from the healthcare system was the main goal of all the measures. This was helped by the relative legislation that had been introduced relatively early in the pandemic, and it supported all the measures taken. But it also led to a division of our society, and because it was challenged, like in probably many other countries, and it was both challenged in parliament, but also in the general population, and it led to referendums on this legislation, and the last one just actually was held this weekend, or the past weekend, and again, a large part of the population supported this legislation. I think it was around 62%. Part of that was due to the communication strategy that was run. So both the scientific community had its way of addressing the people, and the science task force and the COVID task force and the health minister. And I think this helped to support the support of the population in terms of the measures and the legislation. Of course, a positive aspect for Switzerland was also the financial support that was granted, not only to deal with the pandemic, but especially to keep the economy running after the pandemic. And that means grants for companies, but also for self-employed. And I think this, in my view, would be an aspect that might have to be introduced or looked at in more closely in the future. I mean, finances for dealing with the pandemics are, of course, a focus of JEs and all the regulations, but I think it should go beyond that and also look at are there finances available to recover from a pandemic. I'd like to continue with a few points that did perhaps not work very well. One was pointed, or several of them were actually pointed out in the JE. The first of all, we were asked to develop a strategy, an IT strategy, to better be prepared for the pandemics to come. And what was remarkable in my view, that we in Switzerland, the will and the means and also know-how was present to actually develop these tools relatively quickly. I would recall the proximity tracing, for example, also the COVID certificate, reporting system, digital reporting system, the hospital system as well, and or the PLF, Swiss PLF that we developed. What did not work, and I think Switzerland was not the only country, was that we had a problem when it comes to protective materials, disinfectants, or vaccines. In fact, the Swiss stockpile of alcohol was dissolved just in the summer before the crisis. And one of the reasons for that was the risk-benefit thinking of Parliament. Do we still have the money to keep it up? What does it serve for? And then it was decided not to support it and actually to dissolve it. And in coming to the points that Mika Salminen has raised, I think this is one of the important things. How much does preparedness can cost in terms of if we had all the finances, we would have all the laboratories, all the vaccines ready, but no country is able to pay for that. A point that was also raised during the JE was the federal system in Switzerland, where much of the executive powers was actually at the cantonal level. And this interaction has really room for improvement and has to be addressed in all the coming legislations and also the risk, dealing with the risk of coming pandemic. And as has been already pointed out, healthcare workforce really is a problem in every country. Switzerland has made a step, but much more is still to be done to increase the attractiveness of healthcare workforce and by salary or education, because it is essential for such a pandemic to have a resilient workforce there. So when it comes to the JE recommendations, I think inclusion of a scientific part as supporting is very essential for dealing with an unknown pandemic as it had come. So I think the JE could perhaps do something also to help countries realize that, although I guess we don't really need to be reminded of that, but it would help to have there a better, to be included in the questions in the JEE, sorry. An aspect that has not been mentioned really deeply is mental health. Such a crisis has a large impact on mental health, and if that is considered, I think a society of a whole becomes more resilient and perhaps also more able to recover from a pandemic or an event such as COVID. Of course, that also applies for the financial side, and I think, as I've already mentioned, looking at finances for recovery is an important point that could be added. I think I've spoken long enough, and I'd like to pass on the microphone.
Thank you very much. We'll pass it to Svetla, but first Virginia will be joining us online. So Virginia, welcome.
Yes, thank you. Thank you very much. Welcome. Very interesting conversation. I will bring in the EU perspective, especially preparedness elements as they are included in our regulation on cross-border threats to health. So first of all, let me tell you that, the regulation was drafted while responding to COVID. Hence, it incorporates early lessons learned from COVID. And one of the lessons learned, I would actually stress this very, very much, is to invest in health workforce. As Paula said, as all of you have said, I mean, if we don't invest in health workforce, all the other preparedness capacity will just simply not function. I mean, this is a real lessons learned from COVID. So our regulation includes a new article there. I just want to advance a little bit on it. It includes Article 11, which provides for training. So here we have already early lessons learned included in the regulation, which is obviously an upgrade of 1082. I mean, it's a regulation, so it has a stronger, it's strong, let's say, stronger than a decision. Most importantly now, okay, we have the regulation, and now we are, as Stefan was mentioning this morning, we are now in full implementation. We are 6 months into implementing the regulation. And for the preparedness elements, this has meant to start work immediately on the first article, which is the Article 7, which is the questionnaire, reporting questionnaire on preparedness. So just a few words on this questionnaire. Actually, a few words, a little bit more on how we implement these preparedness elements. Is that we have set up a technical working group on preparedness. I mean, Paula is part of it. Finland is also part of it. And we are working together with member states to implement the elements in preparedness in containing the regulation. The first and very, very urgent element is to produce a template, a reporting template for in preparedness. So that's the Article 7, and you know that this article is the most urgent. We have insisted a lot during the technical working group on preparedness, is because there is a strong requirement for reporting. So it means that member states would need to report to this questionnaire to Commission by the end of this year, meaning that we have worked really hard within these 6 months to have a questionnaire that will provide us, all of us, with a state-of-the-art about preparedness capacity. And as you can imagine, this has been done with the in collaboration with member states, WHO, and ECDC. So there, it's the first very strong element, and strong lessons learned from COVID, that we need to broaden the accountability and preparedness. And we start with assessing, with having a baseline on the status of preparedness capacity in each member state, so that we can then see how we can improve those capacity. And this is done actually with the collaboration of ECDC there when we come to assessment of the state of preparedness. And in that we are advancing as well work. And this working group that we have set up on preparedness will also work on a novel element, which is the EU Prevention, Preparedness and Response Plan. Now, I don't want to say much on all these elements because they are in the making, but I have already, we have noted already when the Joint Action SHARP and all of you came to Luxembourg, we have noted down many outcomes of the Joint Action SHARP that could greatly help our work throughout the preparedness chapter. And namely, that will be in our EU Prevention and Preparedness and Response Plan. They are really elements from Work Package 5, Work Package 6, on cross-sectoriality, on multi-sector approach, cross-border collaboration that are very relevant for the EU plan. And last but not least is the need to definitely test, simulate, having those testing, having actually the EU, for the EU perspective is important, of course, to have simulation exercise together with member states. And this is what we are planning to do moving forward, like having those regular simulations all together and to monitor our state of preparedness. So, I forget to say many things, but I trust that we will have a discussion during the panel. So I give the floor back to you.
Thank you very much, Virginia, and very good input from DJ Sante. Svetla.
Yes, good morning, good afternoon. I'm very pleased to be here and in person, and I have several colleagues online listening as well. And as you have heard, ECDC had representatives or focal points for each work package. So you will hear some of my colleagues later on as well on the different areas of work, because SHARP has covered quite a lot. And I will concentrate just now on the work package 5, and we have heard a lot, and what I would say, I will not repeat what has been mentioned regarding the legislation and the needs to report, but we also have the need to find out how to measure whether we progress and how we progress in terms of our capacities and capabilities. So already in 2021, when the pandemic was still in quite in force, there was a conclusion from the Commission, from the European Commission, that there is a need to strengthen IHR capacities, and in particular in areas of surveillance, preparedness and response laboratories, and risk communication. This was published in 21, and these were some of the core capacities that this work package actually explored quite well. Then in 2022, ECDC published a report, and we were very grateful that some countries managed to work with us in the middle of the pandemic. And this was the experience of the first phase of COVID-19 and what were the implications for measuring preparedness. And there again, we explored the areas of surveillance and laboratories and risk communication, as well as health system coordination. And you can find this report published in the ECDC website. And what we have found in this collaborative work is that the existing measurement tools are in general do not consider the hierarchy in the countries when it comes to coordination, and it could be very difficult when an event like this hits that countries are well prepared. Also, these measurement tools do not reflect how the countries can have to adjust their systems. And for example, in laboratories and in surveillance, you had to scale up and then scale down. And that was issue in some countries at the beginning. And these measurement tools, the current ones, do not reflect all this need for flexibility and then how you measure how successful you were. And ECDC also in this work we have produced years before something called ECDC logic model, where we were discussing capacities, which is more or less the infrastructure, capabilities, how you actually act and how you use your knowledge to use the infrastructure, and the outcomes. And probably we need to go back and maybe revise a little bit this logic model and see what else from the pandemic as lessons learned, and what we have heard this morning as a very inspiring speech from Mika. Thank you, Mika. What we can actually reflect in these models. And of course, models and legislation is good to have, but then it's how you really implement it in case of event. And we have tools for this. It has been mentioned, we do analysis, we do in real event like it happened with COVID. Of course, you are forced to implement things, but we also can simulate things. And this was mentioned also, how we enact simulation exercises after action reviews or in-action reviews, and then how we, in fact, learn the lessons, or at least list the issues and try to learn the lessons, and then try not to repeat the mistakes from the past. So we have done a lot of work at the EU level with all of you countries, and as my director this morning mentioned in her introductory speech, we would continue, we would review all the outcomes from this joint action. There are a lot. We will see how much we could incorporate in our future work, and we would continue strongly collaborate with all the EU, EEA countries, but also with the neighboring countries, as we have done in the past and as we are doing just right now, doing simulation exercises together with WHO, after action reviews, also exchange of expertise like these meetings, and also programs to exchange people, which was also one of the elements of Joint Action SHARP so far. Thank you.
Thank you, Svetla. And our final speaker, Jussi. Welcome.
Thank you all. Thank you, Sarah. So yeah, it's a pleasure to be here. I had the opportunity to see the birth of SHARP from THL, also the first part of the pandemic wave as an incident manager, and then after that from the international level, looking at the SHARP progress, but also the pandemic lessons learned. So I'll start with the big picture. So greetings from the Geneva Ivory Tower. There's been many reviews and response assessments and papers being produced over the last couple of years, which have then defined the future work on strengthening this global architecture, they call it now, for health emergency preparedness, prevention, response, and resilience, which is briefly called HEPR. And I suspect you'll be hearing a lot about this HEPR framework in years to come. And this strategic shift focuses on strengthening 5 core capacities, or 5 core health emergency components. So it's work package 5, and we're talking about five so-called Cs now. So there are 5 Cs: collaborative surveillance, community protection, safe and scalable care, access to countermeasures, and emergency coordination. This is the framework for kind of developing future work. And one key aspect is really the stronger realization that health security, primary healthcare, and health promotion are not isolated islands. They're very much connected, and their intersection matters a lot. And also, when it comes to mitigation of pandemics and epidemics, investing in health security is one thing, labs and surveillance, important of course, but then functioning primary healthcare system and hospital preparedness, safe and scalable care, as well as good population health and welfare are also key, and this is highlighted in the HEPER framework. So then more on the practical aspects and response reviews. At EURO, we've very strongly promoted countries to undertake intra or after-act reviews. And to date, we're aware of something like 20 reviews where we know that WHO guidance was used, but there may be others, and hope there is, and it doesn't really matter if exactly WHO guidance was used, as long as the countries are conducting these important reviews. And congrats to Indra for Latvia making a very comprehensive after-act review last year in summer. So I personally led 6 missions on the ground, and we also wrote some papers on the lessons learned. I'm not going to go into details. There's lots of information there for different technical areas, but there are highlights, as again here highlighted many times, the chronic shortage of healthcare workers, public health professionals, not only the number, but also the unequal distribution between the rural and urban centers in countries. Limited pre-pandemic exercises to really test the pandemic preparedness plans. Health infrastructure, digital health infrastructure was not very good. And then there's been duplication of data and decision making between the key responding institutions and political interference as well. But I also would like to mention research preparedness that came up a lot, and Timo, you touch upon that as well. So throughout the course of the pandemic, operational research has been very much needed to support decision making, for example, on how to assess and evaluate the impact of different public health and social measures on the dynamics of the COVID, but also on the wider public health and societal consequences. And this capacity should clearly be strengthened, and this research preparedness in many countries, through, for example, FETP programs. And actually, Timo, one indicator in the new JE tool is about research development in countries. So there is an assessment indicator for looking at this as well. This point also highlights the role of public health institutes. We have written a bit on that. Actually, Paolo, you were also involved in some of the work we did on the public health institutes with Norwegians. So they have a key role to provide independent advice to government, society, and populations, and really strengthening the public health institutions is very, very important in years to come. And many of the findings we talk about here are not very surprising, I think. We have heard about these gaps before, but it's also kind of a finding itself that we keep seeing these systemic root causes coming up all the time. But nevertheless, I think it's very important to document all these findings, even if the findings are not new, even if there are issues in implementation. By documenting these after-act reviews and different response reviews, that itself can create an element of accountability for future. At least then it's out there and people can access this information in years to come. And then just finally on SPAR and JE. So first of all, these tools, they have been revised recently based on COVID lessons learned and other emergency lessons learned as well. But these tools are never perfect. They never will be perfect. It's always good to continuously assess what they're measuring and how and what is the target outcome. There's been some research on looking at JE indicators and the pandemic performance in terms of morbidity and mortality, but it's not really easy task. You really need to take into account lots of contextual factors when you're comparing the JE indicator scores and the performance in terms of mortality and morbidity. So there is some work done on that, and I think more will be done. So just in a nutshell, I would like to highlight that it's very nice to identify lessons, but it's much better to actually learn the lessons. So I hope this meeting and then in years to come will achieve this. So over from my side, I'm happy to take any questions. Thank you.
Thank you. An applause for our panelists. Wonderful. So now we've gotten more information from the 3 countries and our 3 international experts. And part of SHARP has been to come together in different work packages and learn from one another. So the first question I'll start is, how do we continue building on this momentum that we've had with the countries in SHARP and sharing these better practices for one another for better implementation of the IHR? Thank you. Who would like to take that first question? Continuing momentum beyond SHARP. Okay, Paula, thank you.
Okay, I think life teaches us that already. Do not forget that immediately after COVID, we were still in a kind of starting to believe that the vaccine will do part of the job, and that is part of the success in Portugal. We invest a lot on vaccines, and that's why we are in the middle of the whole kind of country's profile on mortality. Sorry. I think immediately after COVID, the fact that we had an hepatitis of unknown origin affecting specific children, so a very vulnerable group. Immediately after that, we had Mpox. Immediately after that, we had the raising of known disease with a new profile, like scarlet fever and all the streptococcus, and now still some new kind of emerging situation. The momentum is still, meaning that if we are learning something, we are learning that there is no more interface between preparedness and response. We have to do them all on the going. And that for me, it's the main key. There is no more separation. And the way this is going to be for our teams is big, because normally we are the ones doing preparedness and we are the ones doing response. And we need to reschedule that in our way of organization, our teams, our procedures, and see how that fits under a more EU or global approach that we can also respond to the challenge. I would put it like that. Thank you.
Timo.
Well, I cannot speak for Sharp. I can say what is being done in Switzerland. Of course, the pandemic is also being evaluated, and conclusions have been drawn how to improve. So the Epidemics Act is being revised, for example, or the whole government crisis structure is going to be revised. And aspects like the better coordination between the federal and the cantonal level need to be addressed and improved, and the connection with the science has to be improved. Also, the protective material, vaccines, there is a new strategy being developed, an IT strategy is being developed. So all these things are going on as a result of the pandemic and the lessons learned. And of course, they should be also internationalized. And what I can say is that we would be happy to collaborate if there is a need or a wish to do that.
Thank you. You see, we continue with that.
A quick note on that. I mean, I think one important element which you often forget is the kind of management of expectations as well. I mean, we all want to do so much now, and if you look at different action after action reviews, JE is recently we had a mission in Kosovo where some of you were actually in the team. You identify lots of priorities which you need to tackle, right? But there is only so much money. There's only the resource pool is not unlimited. So you need to prioritize priorities, and then gradually start fixing some things first, and then moving forward. So we often tend to, when we have hundreds of recommendations, we want to fix them all, but we can't. And then if you don't start gradually by just a few, you may not actually fix anything in long term. So this is just a key, I think, dimension for future work as well.
Yeah, maybe I will look at the perspective from the EU level. I think you have started in Sharp, and you have listed some of the challenges. You have made this analysis of the different simulation exercises that has happened at the EU level. A lot is happening now in the countries with lessons learned and still simulation exercises and after action reviews. So I think these having the documenting the issues is very important, and we need to go back to these documents whenever new event is hitting us, and having this as a repository, being that in the EU level in ECDC or at the global level in WHO or in the Commission, is just something to be available so that experts can consult when it's needed. And sharing knowledge, as it has been mentioned, is important in events like this or in meetings and so on. I think what is important is also having institutional memories on what has happened, and that is something that may disappear because not in all countries investing in public health is still the case. After the pandemic, we just forget a little bit faster, and we start disinvesting, if I may use this word, and that may not be exactly the desire of public health experts. So I think having the memory, institutional memory on what has happened, and still pushing for more investments in public health is very important, and that has to continue, not only to strengthen the IHR, but maintain the IHR capacities.
Thank you,
Yeah,
Indra.
I just wanted to very much support what Jussi said about that, really focusing on what should be done in the future from the learnings we learned. Because now, as a country and as a small country, we have 4 people, including myself, in the department working on the preparedness in a health sector, in an all health sector. So, and with those lot of activities going on, with the upcoming joint actions, with the upcoming assessments, with the upcoming trainings, networks, and everything, it's sometimes not possible to be part of all activities, even if we wish to be. And as well, in general, as for the preparedness, I think really like the streamline activities should be our focus. And yeah, that's it.
Thank you, Virginia. Do you have final thoughts on maintaining this momentum?
Yes, thanks a lot. A very, very interesting exchange there. First of all, to make everything that has been that is really relevant, to make it sustainable, from our instrument here at the EU level, I think first of all, it is important to flag that we have a technical working group focusing really on preparedness, and that is really important because not only it's a diverse group, is really where we intend to focus our discussion and keep the momentum high. I mean, same here, same from DG Santé, and I imagine also from ECDC and WHO, we have been working on preparedness while responding to crisis. We are a small group, really, a small unit. Yeah, we have been doing this now since many, many years. And Paola, you're right. It's so difficult. It's tiring. And maybe sometimes instead of doing this after action review, we could actually do the intra-action review, so like, kind of stop time for a few hours and see what we can immediately incorporate to correct our response. Another thing here. So the technical working group on preparedness is again composed by member states, composed by WHO, ECDC, and we are going to invite all the joint action that we have out there, joint action terror, but more so even now that you have your final conference. So now we really want to invite you to present again the results. And I am looking at the work, in particularly, of course, work package 5 and 6, especially specifically for the EU plan. But also, I want to say that the repository, all these exercises, after action reviews, CIMEX, we are going to upload them in the EUWRS so that there is continuous exchange, so that they are there. I mean, those is not lost. This is a huge amount of knowledge. It's there. We are planning to contain them there. And also, I wanted to also say something about this new this actually improved reporting questionnaire for preparedness. Timo, you mentioned recovery elements. In this new questionnaire, which is based and it's aligned, of course, with WHO SPAR, it's not a duplication. We worked very hard to avoid this duplication, but there are additional capacity, and one of this is recovery. We do ask questions to member states about recovery. So the other recovery elements, we do ask member states about action taken to improve gaps found in the implementation of their plans. So there, again, every 3 years, there is this mandatory tool that they have to be, so the momentum is there as well. It's kept also in having regular updates. And we also have expanded questions in the areas to report on AMR and health-associated infections. We have added in the questionnaire European Commission coordination functions, research and development and evaluation to inform emergency preparedness. So we have tried really to incorporate those elements or expand, as one of the lessons learned from work package 5, on surveillance, labs, and risk communication. So this is just to say that we have tried, with the help of, also here I need to thank Finland for the active participation during the technical working group, and also Portugal. So we have included those questions, and we're very happy to have agreed on these common questions and indicators with the support of ECDC and WHO. So this is from our side, and also I take this opportunity to thank you all, because this has been a 6-month process for Article 7, and we are reaching the end of it. And so let's move on.
Thank you, Virginia. It
Thanks
looks like
a
our
lot.
work has just started, sharp partner. So with that, one more applause for our panel and Lina. So applause.